Good evening, class. My name is Wojciech Kozinski. I'm a student at Herzing University in pursuing my psychiatric mental health nurse practitioner license. Today, my presentation is about alcohol as a substance of abuse. And thank you so much for participating. This topic is very close to my heart because my dad was alcoholic. He drank for many, many years. He just passed away about 3 years ago. Overall, the fact about the data, it's a chemical compound, ethanol. It's a major central nervous system depressant produced by fermenting sugar. It is the most widely used psychoactive substance globally, and it's legal in most countries. How alcohol affects our body, it's mostly through GABA activity, which is inhibitory, and inhibits glutamate, which is excitatory. The effect that it produces is sedation, anxiolysis, euphoria. Also affects dopamine, serotonin, and opioid pathways. It is classified as a group 1 carcinogen, and DSM-5 diagnosis is as an alcohol use disorder, AUD. And it can be further distinguished between mild, moderate, and severe. Prevalence of alcohol abuse is quite significant. It's the biggest from all the substances. Approximately 29.5 million Americans have alcohol use disorder. Only around 8% of affected individuals are properly screened in the primary care settings. And because of that, alcohol use disorder remains widely undiagnosed. Well, history of alcohol abuse goes back into 7000 BC. Earliest evidence of fermented beverages were found in China and the Middle East, which was used in rituals, medicine, daily life across ancient civilization. And even now, today, in the Catholic tradition, is still the wine used in a ceremony in the church. Even in the Bible, there's a mention going back about alcohol. For example, Ephesians 5:18, a direct command from there says, "Do not get drunk with wine, for that is debauchery, but be filled with the Spirit." In the United States in about 1920 to 1933 was national prohibition. It banned manufacture and sales of alcohol. That led to bootlegging, organized crime, and was ultimately repealed by the 21st Amendment. As you know, when the substance is scarce, it becomes more in need. So it creates a lot of opportunities for the black market. In 1970, NIAA establishes as the lead federal agency of alcohol research, shifting society view from moral failing to medical disease model. Recent years, in about 2020, when there was a pandemic of COVID-19, surprisingly, drove of alcohol significantly increased, and the consumption as well. This was one of those factors, was eye-opening how social isolations can have destructive impact on mental health. Actually, one of my colleagues, he committed suicide during the pandemic. So this is also very close to my heart topic. And he struggled with mental health for many years with substance abuse. And, the isolation drove him down. And I think he lost his job. So there was a lot of things going on back then. But moving that, alcohol deaths rising to about 29.3% between 16 and 17. And 2020 to 21, these years. Some facts, the deaths per year, it's about 180,000. Currently, the annual cost, which is very important to mention, annual cost related to expenses related with alcohol consumption, that also considers the crime. It's about $24.9 billion. The admission due to alcohol consumption to ICU, it's about 8.9%, and alcohol is the number one substance related. 13.5% of deaths for individuals between 20 to 39, it's related to alcohol. Female alcohol death rose overall to 34.7. However, in the recent years, the Gallup data show of survey showing that younger generation, Gen X, doesn't drink so much anymore. About 54% of adults admitted to they drink alcohol, which is significantly dropped and the lowest in 9 years. I find it very interesting. This has got my attention because about 2 years ago, I found an article in Wall Street Journal saying that a lot of New York clubs are closing due to significantly lower alcohol consumptions. Male lead in the deaths related to alcohol, 2.8 to 1 female. The highest rates for alcohol abuse is for non-Hispanic white population. And the gender gap is currently narrowing. So before it was male mostly dominant, but I guess females currently are catching up with males. Well, and now let's look on the most vulnerable population. As a genetic component mentioning family history of alcohol use disorder increased to about 4 to 7% times. A genetic variant of enzymes, ADH, LDL enzymes, affect alcohol metabolisms and dependency vulnerability. I personally don't drink alcohol due to my family history, and I do that. When I drink, I wasn't not the most responsible drinker. And about 3 to 4 years ago, I came to conclusion that life is better with alcohol, and since then, I'm doing much better, enjoying my life better. The age in general of consumptions increases to after 15 times, 5 times fold. Male have higher rates, but women show fastest growing deaths rates, 34.7%. And our topic, mental health to alcohol abuse, is quite significant. Alcohol consumption as a depressant leads to a depression, anxiety, PTSD, bipolar disorder. All those things are strongly associated with alcohol use disorder. A lot of people self-medicate to not to bear with their own mental pain. And it is common and destructive. Alcohol temporarily might relieve those symptoms, but then it leads to more depression and more problems, and people become suicidal. So it has a very negative impact. So the long story short, if you don't know how to drink responsible, don't drink at all. Military personnel is really affected by alcohol use disorder. About 16.3% incidence of new onset of alcohol misuse among Marines. Turning 21 during service is the strongest predictor. Homeless and marginalized, disproportional impacted by alcohol-related harm. Barriers to treatment include social inequities, lack of insurance, and stigma. A lot of people deal with mental struggles with substances. Alcohol is the number one still, but a lot of people are going towards less costly drugs, which we can observe right now. The fentanyl is actually a big one. And as mentioned, pandemic impact, COVID-19 amplified high-risk drinking patterns, isolation, stress, and disrupted routines lead to a struggle for alcohol use disorder, later hospitalization and deaths. I do believe, and there was a really wide opening how social isolations and changes can negatively impact human life, and how many we lost people due to alcohol consumptions, which nobody could predict that the virus and the need to stay at home would cause such an impact. Well, alcohol has a two type of different form: short-term side effects and long-term side effects. Let's focus on those short-term side effects: neurological, impaired judgment, decision making, and reaction time. As discussed before, it's related to GABA. It also affects your slurred speech, loss of coordination, your amygdala, blackouts, and memory lapses. Mood changes: euphoria, aggression, sedations. These type of mood changes might be present in people abusing alcohol. Physiological changes: nausea, vomiting, dehydration, tachycardia, facial flashing related to vasodilation, respiratory depression, hyponatremia due peripheral vasodilation. Behavior, a risky behavior, especially among young adults: DUIs, unprotected sex, violence, increased impulsivity, and lower red inhibitions, interpersonal conflict and domestic violence, acute emergencies, alcohol poisoning, life-threatening, especially is large in United States. Blood alcohol content greater or equal 0.3 is life-threatening. Inspiration pneumonia from vomiting, trauma from falls, accident, and assaults. And then, let's look on about the long-term effects, side effects. There are significant. These are actually, I'm seeing a lot of in my hospital. I live in observation unit in Phoenix, Arizona, and we deal a lot with homelessness. So liver disease, as we know, liver affects a lot of function of the body. And alcohol liver disease prevalence, it's 3.5% of general population, 55.1% in those with alcohol use disorder. Well, pretty much you have 50-50 chances of getting alcohol liver problems if you drink. And it's a leading cause of liver transplant in US and Europe. 5 years mortality rate. Cancer risk: it's a carcinogen, as we mentioned before. Group 1 carcinogen linked to cancers: oral, pharynx, larynx, esophageal, liver, colorectal, breast, and breast cancer. And we didn't establish yet the safe threshold to alcohol consumptions. GI and immune: compromised intestinal barriers leading to sepsis risk, causes chronic pancreatitis, gastritis, malnutrition, suppressed immune function, and increased infection vulnerability. Neurological damage: accelerates brain aging within frontal lobe atrophy, Wernicke-Korsakoff syndromes from thiamine deficiency, causes several amnesia, increase overall dementia risk. The Korsakoff-Wernicke syndrome, unfortunately, it's most of the cases becomes irreversible. It's associated with a long-term alcohol consumption, cardiovascular, big-time cardiomyopathy, hypertension. Alcohol increased blood pressure, which can lead to stroke, especially with heavy drinkings, more than 14 drinks a week. reproductive problems with alcohol, fetal alcohol spectrum disorder. So women consuming alcohol during pregnancy might lead to the formation of their children. Where there's no safe limit of alcohol consumption during pregnancy, it's recommended not to drink at all during the pregnancies. Okay, signs and symptoms of alcohol abuse. Physical examination, first thing. As we discussed, tremors, diaphoresis, especially with the withdrawal symptoms, tachycardia. Those symptoms are usually start happening about 2 days after last drink, so you have to be watched for it. Hepatomegaly, jaundice, ascites, they're related to chronic consumptions. People that have alcohol problems are only, especially severe alcohol problems, are only focused on alcohol consumptions. So nothing else really matters for them. They're going to present with the poor hygiene, malnutrition, bruising due to liver damage and coagulation problems. Wernicke triads, that's important. Wernicke triads includes confusion, ataxia, ophthalmoplegia. Now, let's go over the screening tools. CAGE. First thing, this is the screening tool used when we want to evaluate people for alcohol consumptions. Cut down. Have you ever felt you should cut down on your drinking, drug, or use? This can be used to any symptoms to verify dependencies. Second, annoyed. Have people annoyed you by criticizing your drinking use? G stands for guilt. Have you ever felt bad or guilty about your drinking? Eye opener for E. Have you ever had a drinking? Have you ever had a drink use first thing in the morning to get rid of hangover? So this is a CAGE Audit C questionnaire. It's another form, can be used to validate alcohol problems. And there's a questions. How often do you have a drink containing alcohol? And then, for example, there's a scale, never, monthly or less, 2 to 4, 3, 4. And actually all patients in my hospital are being screened using audit form. How many drinks containing alcohol do you have on typical days when you are drinking? And then, another scale is between 1 to 2 gives you 0, 3 to 4 gives you 1, 5 or 6 gives you 2, 7 to 9 gives you 3. And you have 10 or more. How often do you have 6 or more drinks on one occasion? Never, less than monthly, weekly, daily, or almost daily. This is about the screening, very useful to admit. And also there's a CWA clinical tool used to monitor withdrawal severity. In hospital, most of the time it's treated with the Ativan. If we're having symptoms like shakiness, sweating, anxiety, there's a whole scale for that. But this has been mostly used in the hospital across the United States, and I work in about 12 hospitals. I was a travel nurse, and each hospital uses a CWA, widely used among all the hospitals. And then let's lose on lab markers for alcohol use. Elevated CGGT, it stands for gamma glutamyl transferase. It's a liver enzyme. Elevated levels are sensitive but not specific markers for heavy alcohol use and liver. Another would be MCV, is a mean corpuscle volume. Macrocytosis means enlarged red blood cells, which commonly occurs with chronic alcohol use. And that's another thing. And then there's a ratio of liver enzymes. AST twice graded to ALT. Their enzymes related to liver damage. Strongest just alcoholic, hepatic, or advanced alcohol-related liver disease, especially with other supportive findings. Another factor will be elevated carbohydrate deficient transferrin is a specific biomarker for sustaining heavy drinking, roughly 40 to 60 ethanol grams daily for 2 to 3 times a week will show those type of numbers. It rises with chronic alcohol intake. Another INR, which is coagulation factor, which is international normalized ratio, that reflects clotting functions. Elevation indicates impaired liver synthesis function and higher bleeding risk. Low transferrin. Transferrin is a liver-produced protein that transports iron. Low levels can reflect poor liver synthesis function, malnutrition, and chronic illness, and are also altered in chronic heavy alcohol use. Thrombocytopenia, albumin, phosphatidylentol. I'm sorry if I mispronounced that. It's affected. Thrombocytopenia means a low platelet count. Might be due to alcohol consumptions. Albumin is the main plasma protein made by the liver. So as we know, liver affected was going to decrease the production of albumin. And PETH, it's abnormal phospholipid formed only in the presence of ethanol. I guess it's a high sensitivity because it's only present during alcohol. Good biomarker for recent alcohol consumption. Mental status exam findings, appearance, disheveled, odor of alcohol, affected mood, labile, irritable, anxious, or flat. Cognition, impaired memory, poor concentration, slur speech, poor insight and judgment, commonly denial, withdrawal, agitation, hallucination, seizure. Okay, let's look now on overdose and suicide potential. Alcohol poisoning, it's reflected when a blood alcohol concentration increase to more than 30%. What we can observe then is stupor, loss of consciousness, blood alcohol greater to 40%, respiratory failure, coma, death. Just pure alcohol deaths related to overdose is about 2,200 per year in the United States. Alcohol consumption quite often being used with the different substances that significantly increases risk factors, especially if there are other CNS depressants are used, like opioids and benzos. Other problems related to alcohol poisoning are hyponatremia, irregular breathing, can lead to seizures. Alcohol suicide, that's a big factor we're going to go here. 1 in 3 suicide deaths have alcohol in their systems. Well, doesn't mean that alcohol caused directly the death of the patient, but as we know, everybody had some elevated alcohol content in the blood. Almost a lot of people had it, so we know that it's easier to make jump to conclusions, easier to make decisions. The internal moral and internal brakes are diminished. 24% are intoxicated at the time of death. Alcohol use disorder doubles suicide attempt risk. Alcohol presents in top method when people use firearms, hanging, poisoning. So firearms, about 35% people were drunk when they decided to take their life with a firearm, usually shooting themselves. Hanging, 36.8% hang themselves while they're drinking alcohol. And the poisoning is about 32.7% when they're overdose on different substances. Even Tylenol, I saw people trying to overdose on Tylenol, which is possible actually. Acute intoxication increases impulsivity and reduces inhibition against self-harm. Clinical peripheral psychiatric nurse practitioner always assess suicidal ideation in patients presenting alcohol use disorder. Alcohol intoxication lowers the threshold to impulsive self-harm, as I just mentioned this. The combination of depression and access to lethal means is a critical risk, a triad requiring immediate safety planning. Exactly, this is the most fundamental question. It has to be asked. Do you have any firearms in your house? If it is, we have to make agreements with the patient, or use the family resources, or use the resources available in our clinics. Okay, pharmacological treatment for alcohol use disorder, which are ADA approved. And we have a couple of options. Naltrexone. Mechanism of action is opioid receptor antagonist, reduces cravings and rewards from drinking. Dose about 50 milligrams PO daily or 380 milligrams IM monthly Vitrol. That's better options for, especially for people who do not have unable to commit to daily medicine taking. However, it is expensive. And note checks those well, naltrexone has to be taken. We have to check LFTs, to avoid acute hepatitis or opioid use. No need to abstinence before starting. Just take it, be taken right away. Acmaprosate. Mechanism of action restores GABA glutamate balance, reduces post cessation dysphoria. Dose is about 666 milligrams PO, 3 times daily. There's a problem with a high pill burden, so a lot of people might be not willing to take so many pills a day. Best for maintaining abstinence. Renally cleared, contradicted in severe renal impairment. When the creatinine clearance is less than 30%. 30. Disulfiram, another medication used. Its mechanism of action inhibits ALDH, which causes adverse reaction when drinking. 250 to 500 milligrams PO daily. As a note, requires full abstinence before initiation. Best with supervised administration. It has to be informed consent essentials, can cause problems and side reactions of it. This is the whole concept of it. It's associated with the Pavlov's dog, and the negative impact or can be caused. There's no reward anymore when you consume alcohol because we have a negative impact. It might create new patterns of behavior. People don't want to drink alcohol. Withdrawal management: benzodiazepine, lorazepam, thiamine, vitamin thiamine B, because we depleted from it, which is water-soluble vitamins overall. It can be even IV or IM. Another electrolytes have to be checked. It's a folate, magnesium, multivitamin supplementation. Yes, great. Care plan continue. Non-pharmacological education. There's a well-known program, Alcohol Anonymous. It's a step-up program. It is a smart recovery, science-based self-help program. It doesn't cost anything. There's another program for family. So, let me rephrase this. In families where alcohol affects one individual, everybody is affected. And sometimes it's very frequent and often the loved ones blame themselves for the condition of the loved ones. And there's a program called Al-Anon for people who lived in an abusive household or a household affected by alcohol, but it also affects other substances. And it's a family therapy. It's a group therapy. It's good to connect with other individuals to go through that, to understand you're not there by yourself. The other can help. Lifestyle modifications, environmental restructuring, could remove alcohol from home. I mean, honestly, if you want to drink, you're gonna drink, especially severely. But it can be more effective for individuals whose problems it's not so yet developed. Early intervention is the best intervention because alcohol disorder, it just gets worse with time. Especially one thinking point about alcohol. If you have alcohol use disorder, it's for individuals, there's two options: or you drink or you not to drink. If you alcohol use disorder, you won't get cured from that. It's a lifetime abstinence thing, and people have to be educated about it. The problem with alcohol use disorder, it takes quite sometimes for people to came to conclusion that their life is unmanageable and they need some more help. A lot of people live in denial and still use alcohol for many years till it causes more damage to their bodies and as well to the family structure. So the referral and follow-up plan, psychiatric visit, and people who want to get sober, they can go to detox houses. It's a treatment places where they treat people with a combination of medication and therapy. There's a social work. They also have like AA group meetings inside those sober living houses. People usually get there if they hit rock bottoms. I know my friend was a manager for such a rehab facility in Malibu, in California, Malibu. I know that it was a rehab for very rich people, and about month's stay over there, it costs about $90,000 per person. So, long story short, alcohol affects everybody, rich and poor. It doesn't choose. So it's a very destructive substance. Keep in mind that there's a addiction specialist, psychiatrist, especially psychiatric nurse practitioner specialized in addiction treatment. There's self-group AA community resources, SAMHSA helpline, 1-800-662-4357. There's also available hotlines for people struggling with alcohol and trying to commit suicides. Follow-up schedule. Week 1, reassess withdrawal medication tolerability, safe plan review. Well, it's important to have a safe plan in place for people who will have thoughts of suicidal. So will be their safe plan. Week 2 to 4, monitor labs, LFTs, GGT, assess medication adherence, therapy engagement. And then monthly audits like C-score, we discussed that before, relapse prevention, psychotherapy progress, quarterly, comprehensive review, dose adjustment, comorbidity management. Ongoing long-term recovery support, maintaining therapeutic alliance, address social determinants. For long-term users that even been sober for a couple of years, I do believe, as experience I know from friends and working with the patients, alcohol problem never goes away. um, any turn in the life, personal life, any problems can create negative reaction, and people can start using. We call it relapse, and it's a downturn. So you never free. Once people have problems with alcohol, they're never free. So they always. It's good to always involve some in some type of program that will benefit their sobriety. Key takeaways: it's about almost 180,000 deaths annually from exceeding alcohol. 29.3% increase driven by the pandemic. Alcohol is a big carcinogen. As a psychiatric mental health nurse practitioner, we play a critical role in screening, audit, cage, prescribing evidence-based medication, and providing holistic care. Always assess for suicidal ideation. 1 in 3 suicide descendants have alcohol in their system during committing self-harm. Integrated treatment save lives. Thank you so much for listening to me.